Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth. So I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello and welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart. You know, more than 80% of people who suffer from the effects of mild to moderate sleep apnea, they're completely unaware. And as a treating practitioner who treats this pathology that we see so prevalent in our society, there are a lot of people that suffer from sleep disordered breathing and sleep apnea. There are a variety of symptoms which may indicate that you have interrupted sleep. Obvious signs include mouth breathing, snoring, gasping episodes, and daytime drowsiness. Not so obvious signs, though, can include morning headaches, chronic depression, anxiety, chronic pain, fibromyalgia, ADD, ADHD, hypertension, cardiovascular disease, and if left untreated, obstructive sleep apnea can lead to a wide variety of health risks. There's a company, Vivos. It's a medical technology company that's focused on the development of an innovative solutions for sleep apnea. Today we're here with Brian Ferry, the Senior Vice President of Vivos, and Brian has an incredible story, and I would like to share that with you today via video, then we'll bring Brian in. So let's cue up the video.
I took Hunter to school about 7 o'clock. I came home and I opened up the door to our bedroom, and my 3-year-old daughter was sitting on her mom's bed, grasping her hands. And my 3-year-old looked at me and said, "Daddy, Mommy's cold and she won't wake up." And I instantly knew that she was gone. I think there were like 7 police cars and 2 ambulances and 2 fire trucks. Those sounds combined with "she's cold and she won't wake up," it drives me every day. Carrie Eckenrode died on October 27th, 2015 from sleep apnea. We never thought of her sleep apnea as the problem. We just thought it was this mildly annoying thing that we had to deal with. No one ever told us, no one ever raised the warning flag. And had they, maybe I would have made her wear the CPAP thing. What we now know is her entire tormented life and all the challenges physically and mentally that she had are all a direct result of no one figured this out. I had a very good friend of mine who called me one day and he said, I think I met a new client for you. And he introduced me to Kirk Huntsman, who's the CEO of Vivos. In our first conversation, he told me the story of Vivos. He started talking about the studies that have now linked sleep apnea to all these other serious health problems. And I think there's a list of about 30, and Carrie had 9. Literally, the list that he read off to me, I was like, this is her story. This is her list. I started crying, and I explained to him how I had just lost Carrie and that she had all of those things. And those comorbidities ultimately is what took her life. I believe if she would have had this treatment, she'd be here today. She'd probably be sitting in this chair telling you her own story of success. Her entire life would have been different. I didn't know then that it would be my life's pursuit to be able to tell this story and to be able to help families recognize and see the changes that can come through this treatment. That's why this is my mission.
Wow, Brian, what a powerful story. And I know this is your passion. Tell us a little bit more about this and how you came to be in the position you are now.
Well, I'll tell you how the first time I ever had any experience with obstructive sleep apnea was on the 4th of April in 2004. That was the day that Carrie and I got married. We actually got married in the mountains of Belize. And that night we actually slept. So our first night together, we slept in a tree house at the top of the jungle in Belize, if you can believe it or not. And that was my first experience ever seeing or experiencing sleep apnea. And I didn't even know what it was when I was watching it happen. As she drifted off to sleep, I'll never forget, as she drifted off to sleep, she started making this sort of purring sound. And I remember thinking to myself, oh, how cute, she snores. And as the night progressed on and on, suddenly I realized not only did she snore, but I was probably going to have to apologize to our neighbors in the tree houses, because she was a loud snorer, right? Loud snorer. And you know, I didn't know then anything about sleep apnea, and it wasn't until about, I'm going to say about 10 years into our marriage, she had a wide variety of health problems throughout our marriage. She had been diagnosed with chronic depression when she was in her teens. She had been treated for chronic pain and fibromyalgia. She had a heart condition that prevented her from exercising very hard. She would it was called supraventricular tachycardia. Basically, her heart rate would race and she would pass out. Her heart would reset. So we had kind of gone through all of that for years. And it wasn't really until we'd been together about 10 years and she started having some neurological problems. And so they asked us to go, one of her doctors asked us to go and get a sleep study, which we did. She got a polysomnogram, slept at the sleep center for a couple of nights, and she came out, and sure enough, she had diagnosis of obstructive sleep apnea, a rather severe case, I'll say. She had a AHI of 91, which means that she would stop breathing 91 times per hour for more than 10 seconds. Wow. So she had a really severe case. And I got to tell you, you know, throughout the course of our life together, she had a number of different doctors. In fact, the night that she passed away, she had taken 6 different prescription medications for 6 different problems, all prescribed by different doctors. And no one in any of our healthcare, what I like to call the Carrie ecosystem of healthcare providers, no one ever connected the dots that her sleep apnea could be the underlying cause of all of these other conditions. And so, quite frankly, I was like most Americans, most normal people that don't know anything about this. I didn't ever worry about the sleep apnea. I worried about all the other things, but I didn't ever really worry about the sleep apnea. In fact, I tell folks now that if you have an idea or an inkling that you might have sleep apnea, or that someone you love might have sleep apnea, you need to seek treatment. Now, there's a variety of treatments, and I'm sure we'll get into talking about that. But here's the important thing. The night that my wife passed away, she had underneath our bed, she had 3 different brand name CPAP machines. And they had never been out of the box. She had never worn one of them. She couldn't stand the idea of wearing this mask to bed. And so, but I wasn't ever worried about it, right? It was never something that concerned me until that fateful day 5 years ago when she fell asleep and just simply passed away. And I've now since done a lot of research into her death and what actually caused her death. It was complications of sleep apnea. So I don't want to alarm anyone and say, you know, if you have sleep apnea, you're going to die tonight. But the reality is you can. This condition can cause sudden death. But the bigger story, and this is what I've now spent the last 4 years traveling around the world talking to audiences just like this. Of course, we used to do it in person. Now we do it through these video broadcasts. But the important message is that these comorbidities, the things that are so commonly linked to sleep and breathing disorders, they send a warning sign that you really need to look at how are you sleeping. And there's like I said in the video, there's more than 30 of them. And it wasn't until I had that meeting with Kirk. I had the privilege of meeting Dr. Singh. I met several doctors from around the world, including a forensic pathologist who actually studied Carrie's death reports. And I finally put this giant puzzle together. And, for years, Dr. Stewart, I would travel around and talk about how horrible losing my kid's mom was. And it was, and it still is, and it's still something that tugs on our heartstrings all the time. But now I feel bad that I hadn't discovered this sooner so that I could give her a better quality of life, right? Reduce the depression and the anxiety and the chronic pain and all of these other things by simply just getting a good night's sleep. So it was a fantastic life together, and it was an awful moment in our life, but now it's really given me a reason and a purpose that all of it happens, so that I can now do shows like this, travel around the world. I gave a speech last year at this time, actually a little bit more than a year ago, on a stage in downtown Moscow, Russia, if you can believe it. This is a worldwide problem. We've got to raise awareness.
Well, that's an amazing story, Brian. I want to go back a little bit. You said the first night that you spent together in your honeymoon, you noticed her snoring and you thought it was cute.
Yeah.
And we see, depicted in cartoons, in Hollywood movies, when someone is snoring, that means they're having they're in a deep, relaxing sleep. We know different now, don't we?
We do. And, I gotta confess, for all those years, it was a running joke how loud she snored. And my little kids and I used to take these tissue papers, and we would, after she fell asleep, we would make bets on how far, if we placed the tissue paper over her nose, how far she would shoot the tissue paper into the air. We were just like most everybody else. Her snoring was just kind of one of those funny things, something to laugh about.
Right.
And now I know that when I hear someone snoring, I got remarried a few years ago, and so my kids now have an amazing stepmom. But every once in a while she starts snoring, and she doesn't like the fact that I can hear her snoring, because it's like full on 911, right? As soon as I hear snoring, I'm waking her up, and we're taking it serious, and I'm putting on the sleep test device to make sure. But it's kind of gotten to the point now where I can't even sit next to someone on an airplane who's snoring without just nudging them and getting them to breathe again. But snoring is one of the sort of most obvious signs that your body is not going to sleep. Now, one thing that I usually like to talk about here, and you could certainly elaborate on this much more than me. I'm not a doctor, but the interesting thing is the snoring and the breathing is not necessarily the riskiest problem. What's actually happening is when you're snoring and breathing and gasping for air, your body, your central nervous system remains in the sympathetic state, meaning the fight or flight state. And as long as your body is in that state, your brain is not allowing your body to actually go to sleep. And of course, we know that during sleep, our entire bodies, every cell in our body is impacted by sleep. And so when we remain in that sort of sympathetic fight or flight state, we're unable to get to the restful regenerative sleep that we need, which is why sleep apnea has such a big impact on the brain and issues with the brain. So brain chemistry, the overproduction of serotonin, underproduction of melatonin, all of these things. And quite frankly, I'm glad that we're doing this show. I do these once or twice a month, and I just did one a couple of days ago that had 30,000 families on it. And that we've got to let people know that sleep and breathing is one of the things that's making us sick and making us so we have to live this miserable life.
Yeah, you're so right. There's the physiological impact of not breathing well, but then the brain is physiological, but what people don't realize is exactly what you just talked about, the effect on the brain. And the way, what I tell my patients, it's like if you have a computer and you've opened up, 45 windows and you've got videos running, and sometimes you've just got to shut that computer down and reboot it.
Yep.
And now it's all well again. Well, that's what we need to do every night when we're sleeping. I've always thought that's a good analogy. People understand that. And if you're not breathing correctly when you're sleeping, and if you're snoring, and if you're having apneic episodes, your brain never really goes to sleep. You never have that nourishing sleep that is so important in health and wellness. And especially in today, Brian, with COVID, talk a little bit about the immune system and how that's affected by poor sleep and sleep apnea and snoring.
Yeah, it's interesting. I was meeting with a renowned cardiologist in New York a couple of years ago, and we were just having coffee together and talking about everything I'm doing and everything that he's concerned about in his practice. And one of the things that he said to me, and it quite frankly stuck with me, he said, Brian, every system in the body is impacted by obstructive sleep apnea. Not one or two, not every single system in the body. So when we think about that, and you think about your immune system and what compromises the immune system, it kind of starts to make some sense. So I wanted to throw in just a little side note here so that the folks out there can understand sort of the rest of my journey, and then I'll get back to that. But I think this is important. So my wife was 44 years old when she died in her sleep, and I was 46. And about a year after she passed away, I felt inspired and crazy at the same time, and I decided to go back to school. I have a degree in corporate communications and marketing, but I decided to go back to school and study alternative and integrative medicine. So I completed a bachelor's degree in holistic health science, and I'm now pursuing a PhD. In my PhD, I'm taking a look at the impact of sleep, breathing, and nutrition on depression specifically. My wife struggled with depression her entire life, and therefore I struggled with depression, right? I suffered from those things. And so I'll connect immunity in sort of a different way. Our brain is designed to produce a certain balance of hormones and certain chemicals and those chemicals cause reactions, and they go and provide instructions to virtually every cell in the body. That entire process happens when we're asleep. And what folks don't necessarily realize is if you suffer from sleep apnea, you're on average going to get between 1 and 2 hours, if any, healthy sleep. So what happens is in our brain, we have this gland that is directly connected to our eyes. And so when the sun goes down, it's called the pineal gland. When the sun goes down, our brain immediately starts to produce melatonin. When the sun comes up, it starts to produce serotonin. Now, for those of you that have suffered or know someone that's suffering from depression, you know that in a lot of cases, it's an imbalance or an overproduction or an underproduction of serotonin that causes depression and those kinds of things, anxiety disorders. So the interesting thing, and Dr. Stewart, this is something too that we need to make clear, is that not only do you, if you have a sleep and breathing disorder, you probably also have what I like to call really bad sleep habits, right? Human beings were designed, just like I just described, we were designed to get tired and fall asleep when the sun goes down. But here in our culture today, we have TVs and we have lights and we have air conditioning and all of these things that make it so we can easily stay up till midnight watching TV, playing on our phones, doing whatever. And those habits are in direct competition with what your brain is trying to do in order to provide health and wellness for your body. So when you think about the immune system is one of those systems. And if any of those systems are compromised, of course, your immune system is going to be compromised. So I don't necessarily talk too much about the direct correlation between immunity, especially during a pandemic, because I am not an epidemiologist, not even close, unlike 90% of my friends on Facebook who are expert epidemiologists now.
We're all experts now.
It's crazy. But but what I do talk about is that it is impossible. I say this all the time. It is impossible for your body to grow and stay healthy if you're not sleeping. And it kind of comes down to some simple components: sleep, eating, breathing. I mean, those things right there are pretty much what fuel the body. And if you're not sleeping, I sometimes say this and it sounds a little dramatic and maybe over the top, but the fact of the matter is, if you're not sleeping, you're dying. Every system in your body is slowly dying because it doesn't have the opportunity to regenerate and redevelop and develop new muscle always happens while you're asleep. New bone always happens while you sleep. The reason that you fall asleep when you get sick is that kicks your immune system in and it takes away every bit of energy from your body that you don't need to kill a virus or a bacteria. So it plays an important role in overall health. In fact, I say every once in a while, you could probably take care of 90% of what causes you problems if you just would get a good 8 hours of sleep every night.
That's what an excellent statement. That one sentence, what I tell my patients, and I love to use analogies, but I will tell them, all other things being equal, if you take two people, one, they exercise the exact amount, they even have the same genetic makeup, maybe two twins, let's say.
Yep.
One of them eats fast food for the next 40 years. The other one eats fresh fruits and vegetables, lots of fish, eats healthy. Who do you think is going to have most of the medical bills over that period of time? All other things being equal. So, yeah, we can get by on little to no sleep and still live, but that quality of life is nothing like it could be. And we have to respect our bodies and we have to give our bodies what it needs. And the human body is an amazing pharmacological machine. It will do, given the opportunity, what it needs to do to fight off, ward off disease, outside of crazy traumatic injury or things like that. But even then, if you're healthy, you're going to recover quicker from a traumatic injury. You're going to recover more quickly from any type of disease, and you're going to be more stronger to fight off any disease that comes your way. And
absolutely.
And so sleep is so very important for so many reasons. We're going to end up or have to cut out here pretty soon, but one question I'd like to ask you that you might could elaborate on a little bit. What are traditionally some of the I'm asking this rhetorically, I know this, but I want people to hear this from someone that experienced what you did. What are some of the traditional treatments for sleep disordered breathing, and what are some of the newer innovations now that we're coming up with to address those?
Well, I'm glad you asked that, and hopefully I don't know how much time we have, so I'm going to talk really, really fast because this is something that's really important to understand. Obstructive sleep apnea is a pervasive condition right now. In fact, the global health estimates are that more than 1 billion people worldwide suffer from obstructive sleep apnea. Now, the interesting thing is the research tells us that about 87% of people who suffer from obstructive sleep apnea all have one thing in common, and that is what's called maxillary hypoplasia or retrognathic jaws, meaning our upper and lower jaws have not fully developed out to their genetic potential, right? And so it's interesting because 150 years ago, sleep apnea was a very unknown thing. It was very rare, actually. And today, over the last 150 years, we've seen a change in the morphology of our faces. Our jaws are genuinely smaller and failing to develop out to where they used to be. Now, the interesting thing about that, if you think about what could have possibly caused that, there's a number of things that contribute to the underdevelopment of the jaws. You mentioned our soft diet, the Western soft diet. We also know from research by Dr. Coracini and others that other cultural changes have impacted it and made it so our jaws are failing to grow. Now, if you don't believe me, think about the number of kids that you know today who are going to require some sort of orthodontic work, so braces, clear aligners, and I'm going to tell you it's about 2 out of 5 kids. Now, the other thing is ask yourself how many people have to have their wisdom teeth taken out. I tell this story every once in a while. I'm sorry, I'm going to go really fast. But this last year when school was getting ready to start, my wife asked me to go to the store and buy some shoes for my now 8-year-old. And so I did. I got a pair of her shoes and I went to the store and I bought a pair of shoes exactly like the pair of shoes that she had in the closet, just new. Well, I got home and of course I couldn't get the shoes on her feet. Her feet had grown. So these shoes that I bought were too small. So no worries. I called the doctor and asked if we could come in and talk to him. And the doctor said to me, "Oh yeah, come on in." And we sat down and I said, what? He said, "What's the problem?" I said, "Well, her shoes won't fit. I need you to amputate a couple of her toes so I can get her shoes on," which is exactly how we treat our teeth. It's almost become a rite of passage that we're going to amputate 4 of our teeth, our wisdom teeth, have them, we've thought of a better word, extracted. But when you think about it, what other parts of your body do we often amputate just because they don't fit, right?
Well, and you mentioned Coracini earlier. I just may add this in. When he did his research, he's like a forensic anthropologist, and he found that the skull sizes 200 years ago were, 25%. The jaw sizes were larger. The teeth sizes are the same as they are today. So the teeth sizes haven't increased, creating crowded teeth.
Exactly.
Its jaw sizes have decreased, but our traditional Western medicine is to compromise the jaws even more to fit or take out teeth to fit the jaw size rather than doing something about
fixing the jaw size.
And we can do.
Yeah, exactly. So that leads me to what are the alternative treatments. And remember what I said earlier. Don't ignore obstructive sleep apnea. Don't ignore any impaired sleep. Get treatment. There are a number of different treatments, and there's really a couple of different categories of treatment. There are palliative treatments, and there are more treatments that address the underlying problem and correct the underlying problem. So the traditional treatment for obstructive sleep apnea, and this is the gold standard, of course, is the CPAP machine. This is continuous airway pressure that essentially makes it so you don't stop breathing by putting constant air pressure in your face. And besides the fact that it's not incredibly sexy to wear such a device, or it's a little annoying or whatever, the CPAP is highly effective at preventing apnea events. Now, unfortunately, because it's uncomfortable or whatever other stigmas are tied to wearing this mask, it has a very low compliance ratio amongst patients. Just like I said with Carrie, she never would wear her CPAP machine. There's also a number of other tools and resources that you can get from your dentist, like Dr. Stewart. One is what we refer to as a traditional mandibular advancement device. This is like what I like to call a crutch. And you wear this device, and it essentially holds your mouth and jaws in the right position so that your airway is not obstructed when you fall asleep. And these have been shown to be rather effective when worn as directed. There are also a number of new treatments that there is now a surgical implant that you can get that causes, it works a lot like a pacemaker. It causes you to sort of shudder so that you breathe properly. But these are all what I like to refer to as more than likely life sentences, right? They don't target the underlying problem. What we need to do, again, in 87% of cases, is target the underlying problem. Now, of course, we can do surgery on the jaws, which is highly invasive and can be quite painful. But as Dr. Stewart mentioned, I am now traveling the world talking about a new treatment that targets the underdevelopment of the jaws. And in a lot of cases, we can resolve the underdevelopment over a period of time between 12 and 18 months using a new patented technology that only certain doctors like Dr. Stewart are able to prescribe. But it is proving, and I shouldn't say proving, it is been shown to be very effective with folks that follow their doctor's instructions and are compliant with treatment. But a lot of new research is being done into this area because the medical community is now recognizing how serious this condition is. In fact, one of the chief doctors in anesthesiology at NYU, he and I had a conversation a little while ago, and he told me in anesthesia now today, the biggest concern that they have is no longer cardio problems, but actually sleep apnea. So they're now saying if you have sleep apnea, you're no longer allowed to go under general anesthesia unless it's in a hospital setting, because that's how risky this problem can be.
So Brian, as a dentist, I kind of did the same thing you did several years ago when you went back to school and you went into your functional medicine and you learned because of your passion that you and the awareness that you had because of your deceased wife. I have a story as well. My father had horrible obstructive sleep apnea, and at the time I was a dentist, I didn't know. I made him a mouth guard, and he couldn't wear it, and but we used to do the same thing. We would kind of joke about how loud he snored. So 2 or 3 years ago, well, about 5 or 6 years ago, I started looking because I treat TMJ disorders, and I started seeing the correlation between TMJ issues and airway issues. And so when I became a provider and a clinical advisor for Vivos, I started treating my patients with the appliance that we use to grow the jaw and create a functional airway. And what I'm seeing in my practice, I'll give you a perfect example, and I'll need to send you the scans of this patient. 17-year-old male, autistic, making C's and D's in school, a behavioral problem referred to me by a myofunctional therapist who was at her wit's end on what to do with him because he wasn't complying with his treatment and with his therapy. We put him into the orthotic. He went through treatment. He was amazingly compliant. He has that mentality that when an authority figure tells him something, if it's the right authority figure, he does it. Now, he doesn't listen to his teachers or
right.
But there's a reason for that. In 1 year, we doubled his functional airway. He went from C's and D's to mostly A's, some B's. He doesn't get up during the night. He sleeps through the night. He was not a sleepwalker, but he was up at night a lot. This is all coming from his mother. His myofunctional therapist called me and said, he is a completely different young man now.
Wow.
So we're seeing that in youngsters, in adults, in teens. And when you allow people to breathe better, they're just better human beings altogether. They can function better. And so as a provider for this, I am so thankful that I found this therapy that I can prescribe to my patients. Not every patient that comes in my door. It's about a diagnosis, looking at the whole picture, and treating accordingly. But knowing that there's another alternative out there in many cases to a CPAP or to a mandibular advancement device that pulls your jaw forward, it's a wonderful thing. And I want people to know that there are providers all over the country that can offer this.
Yes.
So in wrapping up, before we go to our exit segment, which is going to be kind of fun, what would you say to our listeners that have somebody that snores or that they know has sleep apnea, or they've got a CPAP or two sitting in the closet that aren't being used? And we're not here bashing CPAP machines. Those can be lifesavers. But the reality of it is what you just said. 3 of them under the bed. I see that all the time. What would you say to our audience about
well, so I would say 2 things to sort of wrap it up, and that is, like I said, 80%. The latest estimate is that 80% of people who actually suffer from sleep apnea remain undiagnosed. The fact of the matter is, folks just don't know what's going on with their sleep and their breathing. And so I would recommend that you spend some time and learn what are the signs and what are the warning signs that you can look for. There are literally dozens of things that you can look for. And I would say the most prevalent sign that I see is just chronic tiredness. If you look around our country, every time I see a news reporter or anybody on TV, people just look tired. And the fact of the matter is, with our lifestyle, the high level of stress and the stress hormones that we produce like crazy, the reality is there might be an impaired sleeping problem. And so if you see any of those warning signs, if you see any of them, get treatment. Go in and see your doctor and get treatment.
And the vast majority of sleep disordered breathing, the 3 big ones, snoring, upper airway resistance syndrome, which we will talk about in another episode, and obstructive sleep apnea, those all start in the nasal, mouth, and throat area. That's the wheelhouse of the dentist. So most people go to a dentist more regularly than they do a physician. Your dentist should be screening you for a sleep disorder breathing, like obstructive sleep apnea. 2 years ago, the American Dental Association highly recommended, they didn't make it a mandate, but they highly recommended, it will become a mandate, I'm sure, that all dentists should screen every patient for a sleep disorder, possible sleep disorder breathing. And I think that's wonderful, and that should be standard of care, and it will be eventually. So next time you go to the dentist, ask your dentist to screen you for that. If he or she doesn't do that, find somebody that does. Could be a sleep physician. A lot of physicians don't screen for that either, but more and more of us are doing that. And that's exactly why we're having these kind of podcasts. So if we can make the general public aware of it and they demand it from the medical profession, then it will eventually happen. And I see it happening, and it is exciting. And it's people like you, Brian, that unfortunately had to get into this under the worst of circumstances, but you're not sitting around twiddling your thumbs. You're doing something about it, and I really appreciate that, and I can respect that, and I'm so glad that you're on our team and that we're changing people's lives.
Absolutely, absolutely. I have. I'll leave with one quick outro. I will tell you, I spent my entire life absolutely horrified of going to the dentist. I don't like going to the dentist. I don't like going to the dentist. And now I have literally thousands of dentists around the world who have become my dear friends, like you and your wife and your family. Like it's just been a great mission, and I appreciate you having me on your show.
Well, thank you, Brian. And that leads us to our ending segment. This doesn't take long, but as we do here on Health and Harmony Beyond the Teeth, we ask our guests to pick a song that means maybe not their favorite song, but a song that pertains to maybe to the general feel of our talk. And we play a snippet of that song and we talk about it for just a few brief seconds. So, Brian, tell us what song that you've chosen.
I chose the song "Radioactive" by Imagine Dragons.
Okay, so let's play a snippet from that song, and then I'll let you talk about it.
I'm waking up to ash and dust. I wipe my brow and I sweat my rust. I'm breathing in the chemicals. I'm waking up. I feel it in my bones. Enough to make my system blow. Welcome to the new age. To the new age. Welcome to the new age. To the new age. I'm radioactive. Radioactive. I'm radioactive. Radioactive.
All right. Well, Brian, I love music. That's why we put harmony in this podcast title, Health and Harmony, because health is harmony. But I love music, and music is soothing to the soul, and it speaks to us in different ways. Tell me a little bit about what speaks to you with this song.
Well, there's a lot of people out there that probably discovered Imagine Dragons a long time before I did. I actually heard that song, Radioactive. I heard that song for the first time ever the night of October 26th, 2015. That was the night that I tucked my wife into bed and gave her a kiss for the last time. After I tucked her into bed, I went downstairs and I had been watching a show on Netflix called The 100, and that song was used in that show quite a bit. And I fell in love with Imagine Dragons, and the song "I'm Waking Up to Ash and Dust," breathing in the chemicals. For me, music and rhyme and poetry and prose is all about what the words mean to you, not necessarily what they meant to the author, or in this case, the songwriter. I happen to have studied what the words meant to him when he wrote the song, but the words have become symbolic for me that what's truly radioactive in our world today, what's truly radioactive is our ambivalence and our ignorance of things as simple as sleep. And breathing in the chemicals has become a symbolic line for me that the chemicals that we're breathing in that are causing us to become sick are the fact that we just aren't paying attention and we don't realize. And it's not a bad thing that we're ignorant of these things. It's just a reality.
God bless you and keep up the great work. And I will see you in a few weeks.
You will. Thank you.
Right,
Thank you for having me.
You bet, Brian. Thank you.